Bedwetting, urinary incontinence, and nocturnal enuresis are one and the same thing. And what it means is when you have an intentional passage of urine when you're asleep. It's very common for children to pass urine when they are asleep and sometimes poop. Normally, children who are less than 12 months have no control of their urine, that means their bladder, and nor do they have control of their bowels, that means their poop. As they grow older and get to 2 years, usually as parents, we start training them to achieve the daytime control. We commonly call it potty training. By 2.5 to 3 years, the early developers will start attaining their daytime control and their nighttime control. Usually you achieve the daytime control before you achieve the nighttime control. And after 3 years, by 3 years, 50% of children would have achieved both the daytime and nighttime control. And as they progress to 5 years, 95% of children would have achieved both the daytime and the nighttime control. The remaining 5% might need a few adjustments for them to be able to achieve both the daytime and the nighttime control. So there are two types of bedwetting. Usually boys tend to have more issues with bedwetting compared to girls. And this is because most girls develop faster compared to boys. So there are two types of bedwetting. We have the primary bedwetting and we have the secondary bedwetting. The primary bedwetting means these children have never been able to control their nighttime urine. That means they still pee on their beds since birth. And we see primary bedwetting because of immaturity of the nervous system. Nervous system is what controls the sensation of full bladder when you're asleep, and it sends a message to the brain for you to wake up and go to the toilet. So the children who have not been able to attain this sophistication in their nervous system, they are not able to do so, and so they tend to pee on bed. Please note that this has nothing to do with the child's intelligence. The secondary bedwetting, these are children who at one point in time attained a nighttime control for a significant period of time, and by that we mean at least 6 months of age, at least for 6 months and beyond. But all of a sudden they've started peeing on their beds again. Secondary bedwetting is usually secondary to an underlying medical condition and sometimes a psychological condition. The medical conditions that can give you secondary bedwetting are things like infections such as UTI, that means infection in the urinary tract system. We can have things like diabetes. They tend to produce more urine than normal. Any progressive neurological disorder, that means they're having a disease that is affecting their nervous system. And so they had point in time attained the control of urine, and all of a sudden because of this disease their nervous system is not working normally, and so they are peeing on bed. You can have things like constipation, some worm infections, so that means you really need to make sure you deworm your child at least twice every year after every 6 months. Some psychological issues or stresses, such as, let's say, death of a parent or some conflicts in the family, parental conflicts. Any stress in school can also give you secondary bedwetting, or anything that is a major shift to this child's life can make them go back and they get a secondary bedwetting. Remember, we said bedwetting is unintentional. So as parents, we must always encourage our children and support them because it's unintentional. That means they are not in control of this particular situation. So scolding, calling of names, or embarrassing them really hurts them, and it can really affect their self-esteem. So parents must make sure that even the siblings at home, there should not be any teasing or calling of names, even amongst the siblings. It is best if one does not discuss it is best if one does not discuss the bedwetting problem with the siblings or any other member of the family, so that it's a private affair and this child will be free to express themselves on how they feel, and also on their frustrations. Most of the time bedwetting runs in family. So if there is a parent, as you said, boys are more affected than girls, though it can happen to both. So if there's a parent who at one point in time had the issue of bedwetting when they were growing up, it's best if they share with this child. It really helps to increase their self-esteem and also to give them hope that this will not is not a permanent problem. That means there's one point in time there where they are going to outgrow the bedwetting problem. And also, you should also remember that the child who's bedwetting should be involved in the cleaning up process. In this way, that means they should not feel stigmatized, or they should not be ashamed because of what is happening. It has to be very clear that it is unintentional, and so it is beyond them. So even when they are cleaning and all that, they are able to embrace that problem and able to focus on the problem and not on them as the people who are affected with this problem. Having said that, there are adjustments that one can do to help their child achieve the nighttime control of urine. The first thing is usually you can change the way they take their fluids. Usually we see before 3 p.m. your child should be able to take anything they want as long as it's healthy. But after that, after 3 p.m., restrict on things like caffeine, restrict on juices, especially the citrus fruit juices, any carbonated drinks, and that means these are the sodas and all the packed juices, anything that has chocolate, the cocoa drinks, you should avoid them because these tend to produce more urine than normal. And so them taking will make their bladder feel more than normal, and that means they're prone to pee at night. But please note that these children should not be restricted on taking water. If they are thirsty, let them take water, and yeah, as a need, but not as a routine. If they are not thirsty, it's best if they don't take water. The second thing that you can adjust is that they should always pee before they go to bed. It's very important so that they empty their bladder, and that means you're increasing the time for the bladder to fill. The third thing is you can agree on them waking up at least once at night. Again, this depends with the age of your child. If you're talking to a 7-8-year-old, you can set an alarm for them, let's say at 2 a.m. every night. They wake up at least once at night and go to bed. But if you're talking to a 5-year-old, you cannot tell them to wake up at 2 a.m. by an alarm. You might have to go there physically and wake them up. The other thing you could do is parents wake them up before the parent goes to bed. That means usually the younger they are, most of the time, if you're having a 5-year-old, they'll go to bed by 7 or 8, and they'll leave the parent still awake. So what we would recommend is before your child goes to bed, they go to pee, and before the parent goes to bed, they pass by your child's bedroom and wake them up and make sure they go to pee. Again, the whole reason of doing this is to prolong the time that their bladder is going to fill. Another thing that you could do is invest in an alarm, self-awakening alarm. And how this works is this alarm comes with a sensor, and the sensor is either fixed under the bed sheet or on the child's pants. And whenever the alarm senses wetness, it goes off, and automatically it will wake up the child. And the idea is the child should not finish peeing while they're on bed, but they should wake up and go to the toilet. And once they've done that, they should come up, do the necessary cleaning, and then they go back to sleep. This has been shown to be quite effective, the alarm and also the waking up at night when combined. And that has become the primary treatment when it comes to bedwetting in children, the primary bedwetting in children. as we said, 5%, there's usually a remaining 5% of children who are bedwetting after 5. And out of this, the remaining 5%, 90% will achieve nighttime control if they are able to do all these things that we have just explained for consistently for at least 3 to 4 months. 90% will be able to achieve the nighttime control. So the remaining 10% of the previous 5% may need further investigation, and sometimes, quite rare though, and we don't really recommend, they may need medication because of the same. So just to summarize is you need to support your child. You should avoid teasing and calling of names at home because primary bedwetting is purely unintentional. You should plan, or you should have a plan on how you're going to do this. So either waking up the child at night, or waking up the child before the parent goes to bed, or fixing the alarm, the self-awakening alarm. These have been shown to really work. You can have a reward system. If a child is able to adhere to all this without any problem, you should have a reward system. Let's say if you go through dry nights for maybe 2 weeks for 14 consecutive days, I'm going to give you this, and this is just a way of motivating your child and them feeling that we're in this together. It's very important. So yeah, that's all we have for bedwetting. Let us know what you think. If you have had to go through this, what did you do, or what are you doing, and how is it working for you? Thank you so much. If you have not yet subscribed to our YouTube channel, please remember to do so. Remember to hit the like button and share and share and share. It's always a pleasure having you. This is Dr. Lema at the Health Channel.